Otoplasty is a type of ear surgery that people commonly call pinning your ears back. Ear surgery can include moving the top part of the ear back, or the bottom part, or the bowl portion, which is right in the center, which can make the ear stick out. The way the operation is done, there's a small incision made behind the ear under local anesthesia. Local anesthesia can be combined with a sedative, meaning a pill, or there may be some medicine given through an IV so that you're just comfortable during the operation, not really aware of anything. Once that incision is made behind the ear, there are some sutures that are typically put into the cartilage to fold it back into position. And then in occasional cases, it's necessary to actually remove some of the excess cartilage. Sutures can be put to anchor the ear back closer to the back of the head, but the beauty of that operation is that there's typically no visible incision because it's behind the ear, so that you won't see it at all. There's some bandages put on after the surgery. They're removed anywhere between 1 or 2 or 3 days. Patients can shower, wash over the area, and then I typically have them purchase a sweatband like tennis players wear, which will help to support the ears, particularly at night when they're sleeping for a couple of weeks afterwards. But the operation is done primarily local anesthesia as an outpatient. The operation typically takes maybe 1 or 2 hours at the most. Some people may include in the broad term of ear surgery or otoplasty a torn earlobe. There are many people that have a split earlobe. They may have had an earring that was pulled through. Sometimes just in putting a sweater on over your head, you can catch your earring and it'll pull through. And we can repair those split ears. Those can be done independently under straight local anesthesia. That's one of the operations where you can come in the middle of the day from work, have it done, and we put a tiny little piece of tape that's flesh colored so you don't see any sutures. To repair a torn earlobe is straight local anesthesia, no sedation, no pills, nothing, and you can shower over it the next day. Sutures are removed at 1 week. You can re-pierce the ear then at a later date, typically 6 weeks later. In the classic operation, we'll have a patient who presents and says, I'm getting married soon, I'd like to wear my hair up, and I've never worn it up before. And they'll pull their hair back and you realize their ears are sticking out. It's something that they were able to disguise in their youth, but on that big day they want their hair up. So we'll pin the ears back beforehand so that they can look as good as they would like to on that special day.